Do you suffer from gas or bloating? If you do, you're in very good company. A quick Google search revealed over 30 million searches for help with gas and bloating, not to mention heartburn and acid reflux, other very common symptoms. The problem is not just, well, it's bad enough being in pain. Gas can be very, very painful. The bloating, you're uncomfortable, your clothes don't fit. If you've got stinky gas, it's embarrassing to fart. None of these things are comfortable, but it goes much deeper than that, and it's much more serious than that, because when you have these symptoms, it means something's wrong, and it means something's wrong in the system of your body that is allowing the rest of your body to work. I mean, think about it. If you don't fuel your car, is it gonna go? Or if it's an electric car, if it's not plugged in and has enough battery power, is it gonna go? It's the same thing. So your ability to turn your food into fuel allows all the cells in your body to work optimally or not, or malfunction. So sure enough, when you have gas, when does it happen? So here's a quick health hack for you. If it happens right away, it means low stomach acid. If it happens after half an hour or so, it's low pancreatic enzymes. None of them are worse or better than the other. It both mean malabsorption, maldigestion, but let's start with a low stomach acid, which is really, really common. And it's funny that low stomach acid is so common when the $10 billion industry of antacids, which lower your stomach acid, is a huge industry. And those drugs, whether it's over the counter or a prescription like omeprazole, or you're getting Tums over the counter, these are very, very commonly used because people have acid reflux and heartburn. But isn't it interesting that these drugs actually worsen the condition and set you up for other problems? So let's look at an example. If you have low stomach acid, you're more likely to get infections. You're more likely to malabsorb protein, malabsorb B vitamins, and set yourself up for imbalanced bacteria. There's something called SIBO, S-I-B-O, which stands for small intestinal bacterial overgrowth, which leads to leaky gut. It's an infection, so you're not, once again, absorbing your nutrients very well. So you get in this sort of cascade of events in your GI tract that all start with imbalance in your digestion. So the problem with taking antacids over a long period of time is it actually sets you up for this malabsorption of your protein and sets you up for malabsorption of B vitamins, and the long range effects of that are bone breakdown, so osteopenia, osteoporosis. If you've been on an over-the-counter or prescription antacid for a long period of time, your doctor, if they're keeping track, will start to say, gee, we should check your bone density. Just had a patient yesterday. He said, I was on them for 7 years nonstop, and then finally my doctor said, and this was a man, women are much higher risk for osteoporosis than gentlemen, but they tested him and he had lost bone density, and they said, well, I got to take you off of it. Unfortunately, then he came to see us to get to the real root cause. So this is something that goes beyond the discomfort. We have to get to the root cause. Okay, fine. So now you understand the side effects, which are fairly grim. Infections, H. pylori is another infection that can lead to, it can actually lead to stomach cancer. It can lead to ulcers of the stomach. And believe it or not, you have the symptom of acid reflux, and it feels like you have too much acid, yet the cause of it is low acid. That low acid sets you up for the infection. So it's a little counterintuitive how the body works in this regard, but now we need to fix it. So what is it? Is it low acid? Is it low pancreatic enzymes? Is it both? Secondarily to that, do you have SIBO, this bacterial overgrowth? Or maybe you have other inhospitable organs lower down in your colon. Are there certain foods you're eating that you're reacting to? It can sound very complex, and realize this is an organ system that's only second in importance to the brain and takes up a huge amount of your body. The surface area of just your small intestine is the size of a tennis court. So there's a lot going on there. Plus 70 to 80% of your immune system is housed in your intestinal tract. So it's critical that we figure out why. And that's what I'd love to do for you. So you should reach out so I can help. I'm going to tell you a personal story, and this just happened with me, and I'm almost a little embarrassed, but I'm going to tell you because it's the truth. My husband and I went on vacation in May. A friend was getting married, and we very rarely go on vacation. And while I was gone, it was very hot. We were in Europe and it was hot, and so I was just sort of had my hair back in a ponytail and I had a hat on. You know, it was a little bit of time we were there, and I've always had a lot of hair, but I was putting my hair back in a ponytail every day pretty much, and finally I was like, there's a lot less hair here than there used to be. And certainly as a clinician, I've heard patients complain about hair loss forever, and I used to have such thick hair that, you know, the hairdresser would thin my hair, you know, I had a lot. And I remember thinking when people complained about hair loss, it's like, wow, I could have a little less and not get too excited, but this is a lot. I'm talking about 50%, like the diameter of my ponytail is 50% less. And I don't wear a ponytail typically during the work week, as you can see, so I didn't really notice. And but then I did notice, so it was a lot. So I was like, why am I losing hair? You know, so the first thing you think of is you think of thyroid and you think of sex hormones, and I had recently done a blood test and everything was perfect, and I was like, oh, okay, what else is it? You know, I don't really feel any change, but actually I had some gas and bloating, which was very unusual for me, something I never had. And so started putting it all together and realized, wow, I've got low stomach acid and I'm malabsorbing protein, and because of malabsorbing protein, my hair is falling out. And then I was just sort of putting all this together, and within a week I started having this postnasal drip, something I also never have. And it's like, okay, this is like a little bit of infection almost. All right, I have SIBO. Goodness gracious, okay. And all of this came together in a pretty short period of time, although obviously the hair loss had been coming for a while. You know, hindsight is beautifully 20/20, and I realized that staff, you know, for probably 2 years have been saying, oh my gosh, you shed like a dog, and pulling hairs off, you know, the back of my jacket or coat or what have you. And I never thought anything of it because, once again, I've always had a lot of hair. But in hindsight, I really saw how that all came together, and realized that my stomach acid had gone down, which can happen as you get older. So I got older. But for you, what's the cause? That's what I want to figure out, because you don't want to ignore this. You really want to get to the root cause. It's not difficult, and especially if you've been taking an antacid, or you have any sort of discomfort in your GI tract, we really have to resolve this. That's why I'm here. Please reach out for a free consultation, and I can kind of talk you through the approach, and we can see what makes the most sense for you. Okay, so give me a call at 408-733-0400. We can do a phone consultation or one in person, depending on where you live, and I'm looking forward to hearing from you.